So you found us and came to the training, I think
Yes.
back in 2013, late October maybe. Yeah.
Mm-hmm. Yep.
And so you came to the training, and then did you go back and start doing some marketing towards the end of the year there, or did you wait till after the
No,
first?
it was right after I finished the training that I got a job offer. And so I
Ah, okay.
kind of dropped it. I went back and established the business and came up with my name and registered the business and just kept the registration going, but never did anything until it was August of 2016 last year that we started um,
Oh,
actively working.
because you got that job offer and just kind of set it on the shelf, so to speak.
Yes, yes, knowing that it was there and that I could start at any time and
Sure. Well, so what motivated you to start it last year?
um, I uh, I like to have options. It's just something in life I like to have options
Hey,
and
enough said. I know exactly what you mean.
yeah,
Better to have your own business kind of waiting there in case something does happen with your.
yes, or I just get tired of what I'm doing and I'm ready to commit full time, whatever it is. I just like to have have something going, and I've always
Yeah.
wanted to have my own business, and so this fit in nicely with that. So, and the timing was right with Rachel as well. Last year she was available and looking for something, and so it was a good fit.
Now, is she working for you full time or just part time?
She's full time. I would say that the actual work that we have with the client base that we have is not full time work. So she fills the rest of her time with marketing. Um,
Ah, good.
yeah, we're trying to get at least one more billing client, if not two, by the end of the year. And we have a pretty exciting meeting and demo on Friday with a spine surgeon that we're looking for. So
Oh, you mean day after tomorrow?
yes,
Yeah.
yes,
Oh, cool.
that's
So you've
pretty.
got you've got that demo set up through us, of course, all
Yeah,
ready to go. Yeah, good.
yeah,
And so, yeah, this is pretty exciting when you think about it. You guys have just decided to do what we said to do and pulled it off the shelf and
yeah,
took it out there. Yeah.
exactly. Yeah, and we've really all the information that Vicki Rackner has added since I went through the training has been really helpful. And then the other books that came out, and with
Yeah,
her,
the Thriving book. Uh-huh.
those were really helpful as we were trying to formulate what our messaging was for marketing, and also giving us some confidence that we might know what we're talking about, even though we didn't.
Right, exactly. Well, that's
Yeah.
one reason I wrote the book with Dr. Ragnar was I wanted to give you guys kind of a handbook, a Bible, like here's got all the technology, terminology, everything you need in there, and then you can refer to it it's a great gift for the doctors. It's a great educational marketing tool.
Whenever we get a meeting with someone, we're definitely going to get them as a client. We've found if we can just get in front of them.
Good afternoon, everybody. My name is Patrick Phillips. I'm the founder and CEO of American Business Systems. I'm also the chairman of the Medical Revenue Management Association of America, which you can find out more at their website there. And I'm also on the editorial board of BC Advantage magazine. Over 40,000 people each month learn all there is to know about billing and coding from this print magazine. And I have articles in that most every issue. I'm also an author. You can find my books out on Amazon.com. Here they are. We'll talk about one of those at least during the webinar today. And just remember that we are the only company in America that teaches people how to do medical billing for doctors, that has a lifetime support, has live training, and has ongoing training, all at no additional cost after you pay our license fee. You can find out more about that on our website. You'll see there at the bottom of the screen, absystems.com. We've been doing this for 23 years now, right here out of our offices here in Fort Worth. You can check us out with the Better Business Bureau in Fort Worth and find out that we have an A+ rating. That's the best rating that you can get. And that is right there. There's a little link down there at the bottom of that slide too that you can go to that will take you right to our Better Business Bureau page. Here's our website. There's a special orange button up at the top. If you can't find out all you want to know about our business opportunity here on our website, hit that orange button. You'll go to another page where you then will find all kinds of information that is not on our regular page. This is our hidden, what we call our virtual brochure. We'll tell you everything there is to know about getting your own medical billing business started. We've been doing this, like I said, for 23 years. We have people from every background with no medical background whatsoever, most people, and we put them into business showing doctors how to solve their revenue problems. It's a win-win situation for everybody. You can visit us in our Fort Worth offices at any time. Just give us a call. We'll give you directions and how to get there, and we'll even pick you up at the airport if that's what you'd like. We do live training workshops here in the Dallas-Fort Worth area at a Spring Hill Suites, Marriott Spring Hill Suites, right near the airport. So I'll tell you a bit more about that towards the end of the webinar today. At the end of those training workshops, you are certified as a certified medical revenue manager. And we'll ask our guest today a little bit more about that. So let's see if Marie Chambers is with us today. Marie, you there?
Hi, Patrick. I'm here.
Good. I started to say, well, if you're not, I will have a long discussion with myself today. Well, thanks for joining us. I just wanted to start out by thanking you, Marie. As you know, when you came through the training back in, I guess it was 2013. Is that what we decided?
Yes.
Yeah. I don't remember a whole lot about people after they've gone through the training unless they sign up clients and start contacting me, and I think you let us know, that you had gotten a client or two and were interested in talking to me. So I appreciate you reaching out, because this is most of the folks that are on here today, and there's, I don't know, 60 or 70 people registered today, I think. They all are wanting to know, is this for real? And is this a business that I would be happy getting started? So I'm just going to ask you some questions. I'm going to look at the question box here, though, and see if some folks have figured out that they can actually ask you questions. So, folks, this is your opportunity. As you can see, we're live here today, and it's your opportunity to talk directly to somebody who's been in the same position you're in right now, doing the same due diligence that you're doing. So, Marie, let's start with when you came here. What were your expectations, or when you got through the training, I should say, what was your impression of the live workshop?
Well, I thought the live workshop was great. There was a lot of really exciting energy throughout the entire workshop, and then it carries over once you leave. So it does a really great job of making you feel confident about marketing, networking, and just really excited to get the business started. The one thing that I think probably everyone goes into the training expecting to learn how to do medical billing, and that's not really covered specifically in the training, but you don't need to worry about it until after you get your clients. It's really easy to learn how to do the mechanics of it. So I think the workshop was really beneficial because it helped with the marketing side, and that's really the most difficult part of getting started, is getting that first client.
It's the scariest part for everybody in any business, not just ours. Yeah. How do I get that first client? So let's go from there. Tell us about your situation, because as we were talking before the webinar started, you told me a little bit about the fact that even though you went through training way back in 2013, you obviously didn't get started immediately because you just got your first client last year, I think, recently, yeah. So give us a feel for how that worked and what was going on in your life.
Sure. So I was really excited coming out of the training, and then I unexpectedly got a really exciting job offer back in 2013, and so it was a tough decision, but I decided to take the job offer because of course, that was a little more consistent income, and it was something I wanted to do. So I have been working full-time, and I'm still working full-time in that position in a completely different industry. And it was about a year ago that my cousin Rachel became available and was interested in helping me get the business started, and so I kind of kick-started it again with her, and we really started actively marketing about a year ago, August 2016, and we've got our.
So you literally went through the training, got all the materials and manuals, everything, and went home and put them on the shelf.
Yes, basically. I came up with the business name and got everything set up for the business, and then I just sat there.
But
Yeah.
you had the knowledge, you went through the training, you had it, and so when you put it on the shelf, it was kind of like, okay, even though I'm just getting started in a new job, I know this is here to come
Yes.
back to.
It was so easy to just reference it again, and you could just remember all the energy from the training session, and it was like a package that was easy to pull off the shelf and then start actively employing the training.
Did you utilize the licensee support site? Did you go back and watch some of the videos there?
Yes, and also with Rachel getting up to speed on it, since she didn't attend the live training, she spent a lot of time with those videos, and they were just really helpful from the marketing side, and then also with implementation. When we did get our first client, we relied heavily on the website, and also a support as well.
Yeah, I joke about that sometimes in the training, the fact that people come thinking, oh, I want to get my first client, and I go, now, even though you don't know anything about this business, if I had a contract right now signed by a doctor, how many of you would like to have it? They all raise their hand. And I say, well, that's exactly what's going to happen when you go back. Don't worry about what you don't know, because as soon as you get a client, we are kicking into full gear at that point, giving you some hand-holding, coaching, training, mentors, people who can help you get that up to speed.
Yes, absolutely. That's the best part.
Now, I wanted to say hi to Rachel. I put her picture up here on the screen with yours, but Rachel, you still there behind the scenes?
Yes, I am. Hello, everyone.
Hey, she is alive and real behind the scenes. Now you're in a different location than Marie, is that right?
Correct. Currently, yes, we're in different locations. Yeah.
Yeah, but you work together out of her home. Is that your office, basically?
We do. Yes. Yeah, it's pretty cozy. It's nice.
Well, the doctors don't ask about where you're at. They just want to know that you're going to get their money, right?
Right. Yeah. Yeah. I never worry about missing something because I'm not at the office, so they don't really have to worry about it. I'm always at the office.
Yeah, 24/7. The internet's open 24/7.
Exactly.
And we actually have one client that is in a small town that's about a 3-hour treacherous drive away. And so it really doesn't matter where our office is. We're working with them remotely, and it works well.
And now, was that your first client, the one you're talking about, or your only client?
They were our second client.
Oh, okay.
And, yeah.
Well, why don't let's back up then and talk about when you started marketing finally in the first part of last year, is that right?
Yes, it was in August of last year.
So tell us what that marketing included and how you eventually got this first client.
Sure. So we started with a mailing campaign and then followed up the cards that we sent with cold calling to call all the people that we identified as our target practices, and so we called to follow up with them to see if they had any questions about the material we sent, and we actually got 2 meetings out of that process, and those 2 meetings turned into our first 2 clients.
That's fantastic.
Our first meeting, I want to say it was in September. It was about a month after we started the marketing effort, and then we actually signed with those clients in November. So it took a couple months of meetings and talking about specifically what kind of services they would want to use us for, but once we got those meetings, that was really the key, was getting in front of them and being able to talk about what we could do to help their practices, and just continued on till they signed up as clients.
Yeah, it's just really a matter of educating them enough to where they realize, oh, there's going to be some benefits here. And that's why a lot of doctors, of course, have already decided to outsource. But there's still plenty of them out there that are still trying to do it themselves, thinking they're going to save a nickel or whatever.
Yes, and it's we've been really surprised by how many practices are still on paper records and even paper billings, and so there are a lot of people out there who really need help.
I know. I tell people that all the time, that they're going to be shocked when they find out how antiquated most doctors' offices are. Now, in many cases, like the doctor I go to is really high tech. They've got all kinds of handheld devices and all kinds of stuff. But it just depends on how progressive, the doctor's thinking is. Older doctors, especially, they don't need to learn them newfangled computer things.
That's true, and also just time constraints, and they hear things from other doctors about how much effort it takes to implement an EHR, and then they just never investigate it themselves. So, it takes a lot of education.
Yeah. Now, Rachel, were you involved in this obtaining this first client, or were you with her at that point?
Yes, absolutely, I was. It was definitely really fun to see that all the work we put out into the marketing come through and actually flourish into a relationship with a client, and to be able to explore their needs. And every client that we've had, and they always seem to be impressed with all of the things that we're able to offer and all of the solutions that we have to solve different problems, and they always seem to want to continue to further a relationship and find ways to use our solutions. So that's one thing that I think is always really encouraging to me.
I think that's why they're impressed when they see, for example, have y'all done any of the live demos? Have we done the demos for you?
Yes, we've done a number of demos.
Okay.
And they're great.
Is that what you have lined up for this Friday?
Yes. Yeah, Rachel, maybe you can talk about what we're doing on Friday.
Yeah, very exciting. We have a demo set up with a spine surgeon, and we're going to talk about him possibly using Health Fusion MediTouch EHR and practice management system, and as well us doing some billing for him and a couple of other office things like pre-authorizations and reporting. So I'm really excited about that. That should be.
He's a spine surgeon, is that right?
Yes.
Oh, well, he'll have some big bills.
Yeah, yes, he does. That's definitely a plus on our side.
Yeah, especially if you're getting a percentage of them. Yeah, those surgeons are nice. So this was the very first client. No, you're just talking about one that you're going to do the.
That's this Friday, yeah. So
now,
2 days.
Can you, Marie? Can you kind of explain to the listeners today what that means? What does it mean doing a live demo? Explain that to the listeners.
So we, through our marketing, we were able to get in touch with this doctor, and he is trying to implement an EHR, but he's finding out that it doesn't do all of the things that he wants it to do, and I claim an EMRX does. And so once he said he was interested in seeing it, we contacted Health Fusion and arranged for the demo. When we meet with him on Friday, Health Fusion will conduct the actual demo, and they do a fantastic job with it. It really, you kind of walk away from it going, how can you not want this system? It really sells itself. And so we schedule a meeting. We bring our AV equipment so we can put the image up on the screen in the doctor's office, and let Health Fusion go through the demo. And then after the demo, we meet with him to talk more about what he wants to do and what the next steps might be.
That's very smart the way you do it there. You actually show up there in the office. Did you say with a little projector of some kind?
Yes.
Yeah,
Yeah, we
yeah.
have a little projector and we run it. We come prepared for anything,
Right.
walls or windows or whatever they've got. We want to be able to watch it with them in person.
Yes, you got to be there and see their reactions, and then be there to fill out the paperwork if they want to get started.
Yes, absolutely.
Well, okay. So having gone through that, now I'm confused. Was that the very first client that you signed up? No.
No, so this is a potential client. Our very first client signed up for Audit Guard, and then also we do some marketing work. It's just some experience that I have from a previous job. So we did some card marketing for them and an Audit Guard. And we're still in touch with them. We have a constant conversation going with them, and hopefully it'll turn into a billing client someday. And then
Yeah, that's what you're looking for. It's just eventually I want to get a client that I'm doing their billing for. But all those other services are great ways to open the doors and get in there and talk about stuff.
yes, absolutely. And then we have our second client is this doctor, GYN in Bend, Oregon, so about 3-hour drive from us. And we've been working with him since January. And then we have another client who is a large brain injury physical therapy practice and they're adopting the EMRX and iClaim. So
Wow.
It's been
Congratulations.
Been work with. Yeah, thank you.
That's a pretty good start here for the first year in business. Now you're still working your full-time job. You're just basically managing this behind the scenes. You're the franchisee or the licensee, we call it, who went through our training. And since Rachel didn't go through in the training, how does she know what she's doing?
I spent a lot of time on the ABS website, and I watched all the webinars, and there's so much great information on there. So, and then just billing and things like that, learning as I'm going, using ABS support, and some of the connections, mentors we get through ABS have been extremely helpful in figuring out that process. And yeah.
So we taught you everything you know.
Pretty much.
She would rather have you interfacing, I think, with folks.
Does a great job.
Now, we talked about this earlier and how you can utilize something like this, but one of the books that I mentioned at the very beginning and showed a slide of is this one. I don't know if everybody can see that or not, The New Thriving Medical Practice. Now, I wrote this with a doctor, Vicki Ragnar, who was in practice for about 30 years and saw thousands of patients, and she knew that the biggest headache she had was dealing with the insurance companies and government agencies, so she outsourced her billing. So, long story short is she and I wrote a book for doctors that teaches them how to thrive. In other words, well, this is what it boils down to. You see the picture? Yeah, we want the doctor to make more money. That's what it boils down to. And folks, when you're selling money, it's pretty easy to sell, isn't it?
Yes.
So I just brought that up because you guys are just kind of at the very beginning of hearing about this. We just introduced the fact that we can customize these books and put your name right there on the front cover there, Marie. So you and Rachel just let me know what you want on there, and your name will be right there, having written the foreword to the book.
That's fantastic. That's one of the things we were talking about earlier is how a lot of the resources that ABS offers, like that book, it just lends more credibility to us, especially as we were just getting started and had no clients. It just makes us appear more legitimate and real and committed to the work, and the doctors respond really well to that.
Yeah, and one of the reasons we develop these types of tools is that we hear back from our licensees, and we knew that over the last few years, people had said, it's the credibility. I need some kind of better credibility. Well, what better credibility can you get than to have your name on the front cover of a book with a doctor, an MD? Yeah. See, and not that they know who I am. It doesn't say much about me on the back here, I don't think, but the point is, you're at least on the cover of the book, and your contact information is printed inside the book there as well. So it's a great marketing tool. I think you can buy these literally at our printing cost. It costs $4 to print a paperback book like that, and we'll do that customized for you for that same $4. Anyway, we do that only because we know it's a great marketing tool.
It is.
Now, so let me ask you, Rachel, do you plan to be the one that's going to go out and do some more marketing, or are you guys just trying to handle what you got right now to get it going?
Yeah, we spent a lot of time figuring out what we're doing, but definitely am the one going out and pushing more on that marketing front and trying to grow our business a little bit further. Yeah.
Good. I don't know if there's a medical group up there of some sort, a medical society there, but you might look into see if you can join that as a sponsoring member, and then you become you're a part of your medical community. I mean, you're right smack dab in the middle of the meetings where all the doctors show up, and they look at you almost like as a peer. And if they find out that you're a supporting member, they love you even more than other members because you're supporting the society, and paying for all their dinners and stuff like that, with your membership fees.
Yeah.
Anyway, okay, so I kind of lost track there. You have a total of what, 3 clients then? 3
clients, yes.
Yeah. And what would you need, either one of you, well, maybe you'll have different goals in mind money-wise, but what would you need to do to get to the point where Rachel was completely full-time, making a full-time, and you guys, you were thinking about quitting your job?
We've talked a lot about this, and of course it depends on what specialty a client might be in. Some of them pay a little better than others, but we've talked about anywhere from 6 to 10 clients. Would that be a pretty nice zone to be in? But I don't see any limit to the number of clients that we could get in and the size of the business we could grow.
Now, all of these that you have now came through just your personal contacts, networking?
We haven't done a lot of networking yet. All of our new clients have literally come from the old school method of sending a card, walking into a practice, and leaving some information.
Yes, we refer to that as direct contact.
Yes.
And any way you look at it, it's really not cold because you warmed them up with the card, and they call probably, or at least you followed up, and you had something to connect with there. Same thing with this book. Using this as a gift for the doctor puts it right on their desk the way we teach you to do it. I mean, and they are just. We had one licensee just recently when we first came out with this first part of the year, Marie, that she literally got 3 copies of this because she had 3 prospective doctors she was going to call on that week. Gave them all a copy of it, marked up the way we teach you to, highlighting certain sections and putting little sticky, well, here's one that has the sticky pads on there, see? So when you hand that to a doctor, they see all that. They don't have to read the whole book. They're going to turn to every one of those and see what you highlighted and read it. That sucks them into hopefully wanting to read even more of it. All 3 of those doctors called her up at the end of the week.
That's great.
By the end of the week, all 3 had called her up and said, you know what? I think I've got some of the problems you pointed out in this book. I don't know who you are, but we need to talk.
That's fantastic. Yeah.
What else do you need? From a marketing standpoint, it doesn't get any better than that.
Yeah, well, I'm excited to get a hold of some of those so we can do that too.
Yeah, we're going to get those into your hands. Now, let me ask you this. You guys are both part-time right now. Are you thinking somewhere down the line that you could just continue to work out of your homes and add more people working from their home as well?
Yes, that's a model that I'd like to pursue. I'm open to having an office space someday, but it's nice to be able to keep our overhead costs down so that we can provide good service at a good price for the doctors.
And the doctors don't care, right?
No.
It's like Rachel. Rachel's behind the scenes there. We don't know if she is dressed or not. We don't know whether she's eating chocolate cake with ice cream. She could be doing anything she wants to because she's working from home, right? Yeah. All right, let's see. Here is a question from Jacqueline. Let's see if maybe one of you ladies could answer this. Is a state license required to do medical billing? Is there a territorial boundary, or can you market business outside of your home state?
There's no state requirement for a license for a medical biller. You do have to have business licenses depending on what your state requirements are for just a general business. But
Yeah.
we actually have marketed through networking to clients outside of our state. You can the world is your oyster. I think you can market anywhere. If we were to actually get a client in another state, we would have to go through the process of getting a business license in that state most likely, but there's no limit or boundary that you have to stick within.
Now, I'd have to check into that myself, but my recent understanding of that was that in most states, if you're doing business outside the state, that's okay. You don't have to actually register as a business in every state or every city that you're doing business in. I don't have any licensees that have done that, so maybe there's something unique about Washington. I don't know.
Yeah, so maybe it's even easier. I know there are some tax requirements in Washington that come into play. So, but yeah.
That's assuming you pay taxes.
Correct.
I'm just kidding. I hope the IRS isn't listening in. Okay, here's a Jacqueline. Oh, Jacqueline's also asking, having medical coding experience, is that a plus to have? Did either of you, Rachel, did you have any coding background?
I do not have coding background. I do happen to have a few personal contacts that are coders that are helpful at times, and I've gotten the AMA coding book, and that's helpful. So if someone did have a coding background, I could see it being very helpful, but I don't have one, and I do it without the background.
Yeah, I mean, the doctor and the staff are supposed to provide the codes for you. If they don't, our system has a good way to look those codes up and give them some suggestions too. So that's the nice thing. If they're using the EMRX, they have access to it live just like you do, and can log in and see all those suggested codes. Yeah. All right, let's see. Here's Ty. Can you lend some definition between the family doctor in business for 30 plus years and the clinics that are receiving referrals from them? Where's the sweet spot? And who's generating the leads? That's from Ty. Do you see any difference in the prospects that you're calling on out there, ladies?
As opposed to like a newer practice versus an older practice, how they respond?
He's talking about, I think, an old established family doctor that's been around for 30 years, and he's doing it a certain way or having his staff do it versus, the clinics that are just popping up everywhere and that actually receive referrals from those doctors. I guess he's asking where's the sweet spot. Which one of those would be the one that you want to go after?
I wouldn't limit myself, honestly. I would go after both, but I don't.
Good answer.
I don't think it would hurt either way. There are some doctors that have been in practice a long time and are kind of, this is the way I do it. But then, we have a billing provider. He's a single doctor. He's been in practice a long time, and he's really open to wanting to do whatever's going to be best for his practice. So I think in clinic or single doctor, you'll find both probably. And with a clinic setting, the office manager is going to play a big part in how they respond, and it's going to be that person's role of, their outlook of what their vision is for the clinic. So it's going to be pretty individual, I think, based on who's working there. But I wouldn't limit myself. I'd go for both.
And we've had licensees right out of training go out and find, maybe they had some kind of connection beforehand or something, and find a group of, 15 or 20 doctors that they sign up as their first client. We don't recommend that because, there is a learning curve, and to take on all of that all at one time, it's a time thing, really, is what it boils down to. You don't have the time to handle all that at first, and then of course, how do you get somebody up to speed and so forth. So it's better to grow slowly, like you ladies have. Marie? What do you get a feel for volume-wise right now? Claims volume. Can you give us a dollar figure that you're billing for all your doctors each month, or maybe what you're collecting for those doctors?
So as far as billing goes, we're billing 60 to 70,000 in charges per month. The claim volume, Rachel, you probably have a better sense of this. I would guess it's in like 150 to, well, maybe that might be low. Let's say 200 to 250 claims a month. It's a quick process to enter claims if you're using iClaim. Rachel, do you want to jump in, and maybe I've got the numbers wrong?
No, I think you're in the right ballpark with the numbers, but you're right about the process of entering the claims just takes, I mean, if I get 20 claims, it might take me an hour if I'm slow entering them. And that's not with our doctor using the EHR. If he used the EHR, it would take significantly less time, which we are working on getting him there. But yeah, submitting the claims is actually a very quick and painless process. So that's pretty nice part of it.
Yeah, I think being cloud-based, that's kind of unique for some people. They're worried about the security of it and all kinds of things that might have been a concern 5 years ago, but nowadays everybody is using the cloud. Everybody recognizes that it's just as safe as, probably safer than having stuff stored on your computer in your own office, So it's made it a lot different. Let's see, here's a question. Do you need insurance liability to start your business as a medical biller? Do you have any kind of concerns about that, or?
No, I mean it's I'm sure a good idea to have like a professional liability insurance coverage. We do not have it at this time, but
you can actually get something like that. That's I think it's like an umbrella policy to your homeowner's policy.
That's true.
Yeah, errors and omissions insurance is called, and it just covers errors and omissions inadvertently, doing so. I honestly don't know of any licensee that has it, but I'm not saying it's not probably a good idea like you.
Yeah.
It doesn't cost that much, and if there's some people who are covered for, if somebody breaks their left leg in their driveway on a second Tuesday of the month, they're covered. I mean, that's, insurance can get real specific, and so you have to have your own level, but I've never heard of anybody having a problem. You're basically just doing what the doctor tells you to do. As long as you're not a thief yourself and making stuff up and submitting claims that weren't real or whatever, you're just doing what the doctor told you to do.
Right. Yeah, they're doing the claim, and we're just basically data entering and then following up for the payment. So there's limited opportunity for error.
Right. Carter says, to what extent do you work with the insurance companies and Medicare and Medicaid?
Let me jump in on that one.
Yeah, Rachel, are you having to deal with those on a regular basis, or?
Yeah, I do, because I'm pretty active with claim follow-up. So if there's a claim that hits over 30 days, I'm calling the payers and figuring out, why what's wrong, or if they're just slow, or if I need to resubmit, if there was some kind of error. So I'm in pretty constant contact with the payers, yes.
Yeah, and I think that's just part of running a good business. You want to always know what's going on for your client behind the scenes, because it is their money, but you're the one that's kind of in charge of tracking to make sure it all gets in there like it should.
Right.
That's why the doctors want to outsource to you. They don't want to deal with all of those other things.
Right.
It takes a lot of time. Rachel spends a lot of time on the phone getting answers to questions, and you can definitely see why a doctor's office would not have the time or the people to be able to do that.
Oh yeah, no, they've got more important things, like helping patients to get well. You know, Corey says errors and omissions insurance. It's called E&O. That's how people refer to it. E&O. E&O insurance is not that expensive. As an appraiser, I have $1 million policy for $700 a year.
There we go.
Yeah.
Maybe I'll look into it then.
Yeah, you know, nowadays, you never know. Once you get enough volume and clients to make it worthwhile, probably. Now, Ty says, what is the average on receivables? I think he's asking for an average doctor what you would be, you know, billing each month. You said 60 to 70,000.
Yep. So his gross billings are 60 to 70,000 a month for our largest billing client, and generally in the industry, from what I understand, it's about 75% is what they expect to collect. We say that we can help get you closer to 90% through our services. So that's one of the reasons why Rachel's on the phone with the payers all the time, trying to get to that 90%.
Well, and let's explain why that's important. It's because for every dollar that you collect for the doctor, you're going to make a percentage of that.
Correct.
Can you give us a feel for that in general for people who've never heard of this business? How do you get paid?
Sure. So we like to bundle our services under a percentage of collected fees, and that includes patient payments as well as insurance claims. We have offered pricing anywhere between 4 and 8%, depending on the practice and what services we're providing for them.
Yeah, so it's always a percentage of the total amount collected for the doctor.
Correct.
And that's pretty simple. Your system would tell you from one date to another exactly what was actually collected, and that means accounted for in the system, and that's what you bill for. Hey, we collected $70,000. We're going to bill you 7% of that, or whatever it is. Yeah.
Yeah, it's very straightforward. And that's pretty standard practice in the industry, so they're used to, they expect to see a percentage.
Yeah, I think there used to be folks who would recommend, in fact, we probably did in our early days years ago, recommend that in some cases for some doctors you might just bill so much per claim, you know, $7 a claim or $8 a claim or whatever. And that didn't seem practical for most doctors. They want to see it as a percentage because they know every extra dollar you get, you're going to make money, and that's the incentive that you have that his staff doesn't have, you know,
Absolutely.
normally. Yeah. Okay, so Ty, I don't know if that answered your question, what's the average on receivables? But if you're asking about for each insurance bill, that'd be hard to say, wouldn't it? The type of doctor and all kinds of things.
Contracts the fees he has negotiated, and what services are provided. There are a lot of factors in what the actual billing is and what the payment comes in at.
Yeah. So Corey's asking, are these ladies finding that the 96 to 98% acceptance rate for claims, as is typically noted in these webinars, is what they're actually seeing using the ABS system? Mm-hmm. So is that about right, that in the 90s that you're? Yeah,
I think so. The Health Fusion in the iClaim system has a great dashboard that tells you exactly where your claim is in the flow, if it's in the clearinghouse, as soon as it gets accepted by a payer. And Rachel, you chime in here. I think it's definitely in the 90%. We haven't actually run the numbers, but we barely.
I think maybe we haven't run the numbers because it is such a small percent. I would say that's spot on. It's rare that we get a rejection.
Do you know from our technology partners, Health Fusion, we're finding that they are actually tracking this nationwide now, and it's down closer to 1% overall rejection rate. Now, that's very unusual in this market but made possible by the fact that we have our own clearinghouse. It's all built into the iClaim system. We don't have to send it to a third party, so you don't have that third party making decisions about whether or not it should be paid or not. If it don't get paid, the buck stops here. That's the great thing about our system. Let's see, Tanya, what are the pros and cons in starting this business? Okay, that's a big question. Give us some pros and cons, Tanya, or Rachel, either one.
That is a big question. I think for me, when I was considering starting this business, I really selfishly like the opportunity to work from home. That was an attractive piece to it. The opportunities to support private practices, this is kind of a lofty goal that I had, but you just see how many private doctors are being swooped up by bigger groups, and it seems like it's a really important time to be in the medical industry and help support those doctors who are trying to do it on their own and really focus on patient care. So it is, from a satisfaction standpoint, it feels good to be able to help people in that situation.
And the cons?
Cons for me, it definitely takes commitment and effort to market the business, especially if that's something you're not used to doing. There is a learning curve there, and you just really have to be out there every day, continually doing the same marketing effort until you find that one person who is willing to talk to you about it. So it's not for the faint of heart, for sure.
I tell people, look, it boils down to this. No matter what business you start, somebody has to go get a client, the first one. The nice thing about this is that once you've got a client, if you're doing a good job for them, those doctors know one another, and the referrals will start coming.
Yep, that's a great way to put it. Yeah. Yeah, once you get in the door with one of them and they can see what you can do, it definitely generates more business.
Sure.
But yeah, working hard is a common thing in any industry, in any business, especially as an entrepreneur. So that's what it is. You do have to work hard at it.
Yeah, you do. I tell people it's the most rewarding hard work that you'll ever do, working for yourself, right? You're going to be a lot stricter on yourself than a normal boss would be.
That is true.
Rachel, for you, what's the good parts or the bad parts about this business?
Good parts. I definitely like being able to work from home and helping out private practices, like Marie said. That's a great part of it. And just getting to be your own boss and finding satisfaction in I took the time, I did this well, my doctor got paid, and we're getting paid, and that feels good to know that you're doing right by your doctor and your business partner and yourself. So I think it's really rewarding to see, you put all this hard work out and you get the client, and it's just rewarding. It is. The con, it's not for the faint of heart. Marie's right. And if marketing isn't something that's in your wheelhouse already, that can be an intimidating thing to jump into. But like I said, it's rewarding enough that it's worth it to take the steps and just do it.
Yeah, it's one of those things that everybody has to overcome. Of course, fortunately, Rachel, unfortunately for you, you weren't in the class, but you've seen some of the webinars. We teach about a dozen different ways that people can go out and market this. And some people get stuck in their mind that this is the best way to do it, so they'll do that one. And it's kind of like the definition of insanity. They keep doing the same thing over and over again. Don't get a client. Well, why don't you try the other 11 ways that we taught, during the week to do that as well? So sometimes people try different things, and finally they get one that works. And they think, oh, well, that's the magic bullet right there. Well, not necessarily. It was for you because all the circumstances were just right. For somebody else, it might have been using, trade shows or giving seminars. I mean, all kinds of ways have been, gotten business. So,
Definitely.
but hey, that's a realistic part of looking at starting any business. The nice thing is you can put this one on the shelf for a year or two and still pull it off and then do it because it's going to be around forever. There will always be human beings who get sick, who have to go to the doctor, who have to get paid.
And of course, the support from ABS is always there as well, and all the resources that you put out that's really, it makes it much easier than just starting from scratch with no background or resources.
Well, that's important in any business, but I would hate to think that I paid $26,000 for a license for something, and then after I left the training, that was all. There was no background help in any way. We, as you know, Marie, make money on all the services, including some of them I'm showing here on the screen, and so we make money on everything on the back end as well. That means we're going to help you get as many clients as you can possibly handle. We want you to make money because we make money too. Yeah, that's a good thing. Okay, I'm seeing some other questions here. Some of them are incomplete statements, and I don't know what the context was. Okay. This one is from Tanya. Were you offered any leads? She means, did we give you a list of names of doctors and to go after?
In the training, we went over how you can Google search to start finding leads on your own, but ABS doesn't provide the actual leads for you. You do have to do that work on your own. And it's important, I think, as a business to figure out what your target market is and then generate your leads list from that target that you're trying to pursue.
You're doing exactly what we taught you to do. That's right. Everybody wants a shortcut, and I think the reason this person is asking that question, there is a company out in California that actually sells a training package similar to what we sell, and they tell people that they're going to include the names of 500 doctors in their area or something like that. Well, you can find that anywhere. There's no big deal for that. Yeah. If that's what somebody wants, I can certainly provide them a whole lot more than that, though. I think in the Dallas-Fort Worth area, there's like 10,000 plus medical providers, so it's not a list, though. That's not how you build a business. It's through some of the secrets that we teach about warm marketing and even the networking. That's all very important to build a business in any community.
Yeah, absolutely.
Okay, Daryl says, has Marie and Rachel tried using sales reps up to the point of just independently marketing on their own? Oh, up to this point. Or have y'all just independently marketed on your own?
We've been doing it on our own so far. We have not used any sales reps.
We do have an entire sales rep training program for those of you listening. That's probably where this person who asked the question heard about that. We do teach people how to hire and where to find people and how to pay them, and we even have training modules that are available through us directly to them that don't give them all the information about being a licensee. So we can help you with that if you ever get to that point where you want that.
That's great.
Yeah. So Peter says, so the system seems to be performing at about 98%. He's still about how many claims are getting through, versus how many are rejected. Are the ladies finding the 30 to 40% rejection denial rate is actually happening at providers? In other words, from the doctors y'all have spoken to, have you gotten an indication that they are getting a big rejection rate?
Rachel, do you want to answer that one?
I think that's hard because some of the doctors just don't know what their rejection rate is.
I believe that, yeah.
And that's part of what's difficult for them is maybe they don't know. They don't have someone to tell them. They don't have a biller or a partner like ABS can help you become, this partner that can provide all this insight and all these different things. And Health Fusion, that iClaim and EMRX, they have all this great robust reporting system, so you can supply all this information to your doctor once you're working with them. But I think a lot of doctors don't know, and that's hard for them because, you know, it's a big question mark, is am I doing all this work and it's not getting paid because something's getting rejected? And yeah,
Right.
I think that's a hard part for them sometimes.
Yeah. Richard mentioned, since you mentioned Health Fusion there, he says, who is Health Fusion and who is ABS? That's okay. I just sometimes don't make it clear on these webinars that we talk about our technology partners and that behind the scenes we make money on all the services provided through our technology partners. Well, that's because we're not a technology company. We didn't write any software. We don't own any software. What we do is private label and white label the products for our licensees through companies like Health Fusion. So that's who that is, Richard. And you can find out more about all of our technology partners. During the training, we actually introduce you to all of them, and you're basically partnered with them from that day forward. Okay, let's see, ladies. I have about 6 minutes here, so I'm right down to the line. I'm going to try to get through some of the questions here that people have asked, though, because those are more important than the questions I would have anyway. So this is from Tina. She says, is this billing system for family doctors only? What about the specialties, dentists, and naturopaths? You can bill for just anybody, any specialty except for dental. That's the answer. Yeah. People think the dental market is a big market out there for billing, but they use a completely different system. They have to have x-rays attached to most of their claims, and it's a very difficult system, a very difficult thing to do. But if you want to, we have systems available, cloud-based systems that will let you do the dental billing as well. We're not going to support you on that. We're going to teach you how to get it going and get it started. But your biggest market, folks, is in the medical field. Believe me, there's lots more doctors, see lots more patients, and not many people have dental insurance. I don't. Let's see. Some of these are just, average days paid. Tide says, what is the average days paid? Do y'all have any feel for that, Rachel? Do you know what's the average number of days that when you submit a claim that the doctor can expect to see it paid?
Most payers would say that they should have a turnaround within 30 days. So you definitely want to be seeing a payment within 30 days, or you need to be following up on it.
Yeah, definitely. Our average nationwide is about 14 days, but we've actually had licensees submit a claim on Monday, and the money was in the bank account for the doctor on Friday. So it just depends on a lot of things. But not having that third-party clearinghouse that I mentioned earlier, that every other medical biller except for our licensees have to deal with that third party, that will slow down the payment there too, of course. Okay, let's see. Boy, I got one of these Mac computers that I can blow the screen up as big as I want, and I still have a hard time reading some of these questions. They're little bitty box here. Okay, now they're backed up. Okay, some of these again are disjointed statements that I've lost track of the context. Okay. Oh, the person's name is Oki, O-K-E-Y. All right. Does ABS have a standard percentage rate recommendation for licensees to charge the doctors for claims collections? Well, I think probably when you went to the training, Marie, you probably heard the 5 to 8%. Is that what you remember?
Yes. Yeah, that was the suggested range, and that's what we've worked within.
Good. Yeah, I mean that you can make plenty of money at that. Sounds like a small percentage, but when you're billing, $75,000, $80,000, $100,000 a month for a doctor, it mounts up fast.
Yeah, it really depends on the specialty, how high the rate could be.
Yeah, Yeah, that's right. And Oki, it's not like we even have any control over that. You know, when you buy a license from us, you're licensing the use of our systems and our marketing materials and so forth and our ideas, but we don't have any say-so as to what you can charge or not charge. So that's all up to you. Allison says, how long is the training course? Back in 2013, was it 5 days basically?
Yes, it was 5 days.
You went home on Friday. Yeah. Okay. And was Cynthia the instructor back then?
He was, yes.
Okay. Good. All right. Let's see. Okay. Here's one last question we'll ask. What have you found to be the most challenging aspect in this business since you've started? That's from Daryl.
I think I would go back to just getting that first client, and it was challenging, but we were able to do it and get one relatively quickly as well. So.
Yeah, from the time you started doing the actual marketing, didn't you say it took you about 30 days?
It was about 30 days, yeah.
Yeah.
Yeah. So a challenge, yes, but not overcomable for sure.
Right. And Rachel, what last words from you? What have you found the most challenging part of doing this business?
Yeah, I would agree with the first client and just getting up, doing the marketing, going out, making the contact, and that first practice analysis and that first meeting with that first client. That's the biggest hurdle. And once you're there, you realize, wow, this isn't as scary as I thought it was. It didn't have to be that big of a challenge. I'm here and I'm doing it, and it's awesome. So it's intimidating. It's a challenge, but it's definitely something you can get through and get the client afterwards. So
it's a great feeling to have a client that you found, on your own. So I'm very proud of you ladies. You've done a terrific job. Marie, congratulations for wisely bringing Rachel into your business. I think that's a great partnership that you guys have got, and wish you the best.
Thank you so much, Patrick.
Yeah, thank you, Rachel.
Thank you.
All right, bye-bye. I didn't even look at my email. Did you send me any other pictures?
I did. I sent you one, and you don't have to use it if you don't want to, but it was a cute one of Rachel when we picked up our first check.
Oh, no, I want to see that. Let's see. I love that.